St. Mary's Hospital has been a cornerstone of Jefferson City for more than a century. The cornerstone of the old St. Mary's was laid in May 1904. Since then, families have been born here and have worked at a hospital they've considered home. Members of those same families, as well as others in Jefferson City, will get a new experience as SSM Health St. Mary's Hospital Jefferson City moves here to its new home. It's just a few miles away from its original location. The new facility has been a labor of love, but as you're about to see, it remains true to the commitment made more than a century ago to bring state-of-the-art healthcare to the very community it serves.
I am extremely proud of the design of this new state-of-the-art facility, but it's not about the bricks and mortar. It's about the care that's provided inside. And the employees of St. Mary's and our strive to be exceptional truly deliver the highest quality, safety, and customer service of any facility in mid-Missouri.
It's not like the property was acquired and the interchange was built and the roads were built and the hospital was designed all as one part of one big master contract. It was really an incremental set of dominoes. And for several years, everybody in the community, they were watching the dominoes to see if they were going to fall.
Planning for the facility began in 2004 when the foundation and SSM acquired the land.
For about $3 million. That was very significant from a community standpoint because it showed the world, it showed MoDOT, it showed the city, the county, and it showed SSM that this community was really behind the idea of a new hospital.
Knowing that in order to continue our 105-year legacy in this community, we would need a new facility.
Once SSM said, we will build a hospital as part of an economic development project in order to acquire MoDOT funds, and if we change our minds, we will pay for the interchange. When that commitment was made, we weren't ready to break ground. We weren't ready to really pop the champagne corks. But when that decision was made, we felt pretty confident that the train was going to leave the station.
The system then approved the facility in 2008, and almost immediately after, we began the visioning session, working with the community, employees, and the physician to design the hospital of the future. We flow-charted the current process, looked for what worked well, where there are opportunities for improvement.
And then from there, we went into developing, this is what we want our emergency department to look like, this is what we want our ORs to look like, our patient rooms, our main concourse, all of that. We were able to take those concepts and put it into play.
Lots of people had input from housekeeping to nursing staff to accounting. There was a representative, one or more representative from all the departments within the hospital.
You get to build a new hospital. What do you want in that hospital? And being able to see, okay, yeah, I'd really like this or I'd really like that. But then having to go out and say, what are best practices? What is the latest design? What are those features that improve patient safety, employee safety, all of those components that we could put into this new design.
We also practiced being a family member. We would sit where the family member section of the room is, and we would think about if we were a family member, what would we need? You know, do we want to be able to have access to the TV? What if we want to read, but our loved one doesn't want to read? So we worked through all of those things.
Members of the community who had been patients or family members of patients participated in sharing their experiences and what they wanted in the new St. Mary's Hospital.
It wasn't just, you know, this is what we want from a leadership top down. It truly was a bottom up, asking our employees, this is what we need in order to provide the best exceptional patient care, as well as taking care of our employees, but also getting input from our community. Our community is a vital part of our everyday operations, so we needed to ask them what they wanted to see in a brand new hospital that could serve us for the next 100 years.
We knew we weren't going to be here until 2016 is what we thought. So we had to figure out what are we going to need that many years later. And so we had to really think outside the box. We're talking about technology. We were encouraged and pushed by the architectural team to say, this is your dream. What do you want in your dream? So really that was one of the hardest things to come up with, is because you just kind of want to think, what do I want today? What do I want today?
The architects that we use build and design hospitals across the nation. So we were able to take experiences that they had and also know, here's someone that's doing this really well. Go visit this facility, look at this, see how they're doing this. And also the literature, making sure that we were doing evidence-based and making sure that we were able to provide, again, the utmost safety to everyone involved in this process. That is what means the most to me, that I know this building will continue to provide exceptional health care for the next 100 years in the community of Jefferson, as well as all of our surrounding areas.
And this hospital was planned to be much more efficient, much more patient-centered. Our design is meant to keep our caregivers at the bedside.
If a patient turns on their call light and I walk into the room, there is a sensor that I have that I will carry near my badge that will identify that I'm in the room, and the call light goes off. If I am looking for one of my peers, I can look down the hallway and I can see where they are because they have a sensor that tells me where they are.
We have all private rooms. All the rooms are same-handed rooms. That does a couple of things. It allowed us to actually build the hospital in a more cost-effective way because we had the same design repeated over and over again as it relates to our patient rooms. It also is better for our caregivers as their orientation to the room doesn't change depending on what room they're in or what floor they're on.
So there's a greater sense of privacy as well. Every single room is private. Every single room has its own door. So there is a greater sense of privacy here for our patients in this new facility.
Large rooms, all private and quiet. And when you move from a hospital where you're used to carving out space and curtains between rooms and things like that.
And then lastly, for the patients, again, it's a much safer environment. Because they're the same type of room, we were able to build consistency within our technology, within our spacing, within our equipment. So at the forefront of the St. Mary's design was patients first, and then surrounded by the caregivers to be as efficient as possible.
So we would have had to have 3 different locations staffed in the old hospital to be able to serve those patients. We have them all in one area. So instead of having one nurse with some backup, we now have one nurse with multiple other nurses in the department that can really help service those patients.
In today's design, we have 24-bed nursing units, 12 on one side, 12 on the other. And what's unique about the way the new St. Mary's is built is there's no longer the historic nurses station. And the purpose behind that, again, is to put our nurses and our nursing teams closer to the patients. Each room is built what's called same-handed. So we have alcoves where our nurses and our technicians and other healthcare professionals can sit outside of the room and be able to view into the room, be able to do their work outside the room, and then enter the room pretty quickly when necessary. So they will be dispersed and put closer to the bedside and not centrally located in the old nurses station. We think that's an advancement, and we believe that's one of the things that will differentiate St. Mary's.
The way we provide nursing care and physician care to the patients is just totally state-of-the-art to really let patients have an exceptional experience. In addition to the fact that we also have a lot of brand new, nice, state-of-the-art equipment that really helps us stay at the cutting edge of technology in the OR.
We have very new equipment. About 70% of all the equipment used at the new St. Mary's is brand new to us. That was on purpose. We had it planned that way. So we're very excited. We have an interventional platform where we have our emergency department and all of our interventional spaces on top of it. That platform in and of itself is built and designed to be efficient for patient flow, but also for the advancement of technology.
So the interventional platform is essentially all the procedural areas in a hospital. So we have the operating room, we have our gastroenterology department, endoscopy, some people know it as, and then our cardiac department, all within the same area.
Half of my work comes from cardiology and catheterization, so it's nice having that so close. So in case they have a patient that they'd like for me to come take a look at the films and talk to the patient about surgery, it's all on one floor, so I can easily go there and talk.
And then as far as the OR itself, the OR is built around a large storage room. So there's a large storage room in the middle. The OR suites themselves where procedures are performed are located in the perimeter of that storage space. And that gives a lot of efficiency for the doctors and staff because any supply or instrument that they might need during a procedure is right outside their door.
Our equipment, all of the sterile supplies are located closer to where the nurse is at, so she doesn't have to travel as far, she or he. and they can be closer to the patient. There's less interruptions in patient care. They can stay closer to the bedside, and we keep more focus on the patient.
Because a lot of times if you have to run from one side of the operating room to the other to get something for the surgery may stop, and it enables for all of us to get flowing. What's also nice is the camera box is here, at least for me. I do all the thoracic surgery here at St. Mary's. A lot of that's the minimally invasive or the VATS procedure. So it's very nice that we have each of the rooms, except save one, has now the new updated scope equipment.
We perform a large portion of minimally invasive procedures here, laparoscopic procedures, arthroscopic procedures. They're procedures performed utilizing video equipment. That minimizes the recovery time for the patient so they can get back to their normal lives quicker.
We currently do minimally invasive surgeries at the current hospital, but now we can transfer and take those procedures and we can do them here with newer, better equipment, more advanced, and so we can provide the same care.
It's not like we're starting from ground zero doing those minimally invasive procedures here just because we built a new facility. We're transporting an already very skilled team from an older facility into a state-of-the-art building that is really designed to be able to accommodate those procedures.
Some of the technology is installed in the new hospital, and we get to see it right when we start using it. For example, portable x-rays and other x-rays. The current technology, you shoot an x-ray and have to develop it, and it only takes a few minutes. But the new technology is that you shoot the x-ray and it's on the screen. And so that's actually terrific for taking care of trauma patients and other issues where you need to know right away how to take care of them.
The Imaging and Testing Department is located on the first level of the Imaging and Testing building. It is located adjacent to the Emergency Department and adjacent to the Outpatient Registration area. And the purpose of that is for quicker turnaround of results for the Emergency Department and ease of patient access for our outpatient patients. 3D mammography is a powerful screening tool in the detection of breast cancer. The 3D technology allows for a higher sensitivity and a better detection of invasive cancers. Additionally, 3D technology also will support fewer recall rates, fewer false positives, which is where the patients have to come back in and have additional testing or repeat testing because of questionable results, which will help with the patient's peace of mind.
We're able to access strips online and can really have a better grasp of everything that's going on the unit at the same time. Blessed Beginnings is a motto that has become what the Labor and Delivery Suite kind of stands for or embodies. So Blessed Beginnings itself, we feel like every birth is a miracle that should be celebrated and cherished, and it's a special part in a woman's life, a family's life that we get to be a part of, and we want each family to be able to have their unique experience. The rooms are much bigger and allow all of the action to happen in one place, and that really facilitates the care for the mother. It's more convenient for the patient, it's more convenient for the caregivers to have everything all in one room. It also adds to that hotel-like atmosphere where you come in, you check in, this is your place, you make it home for your stay here, and it's yours. It's big enough, it's huge for your family to be there and visitors to come, but it's also cozy that you feel like it's yours.
What we've created here really truly is, in my opinion, a blend of nature, modern facility, and spirituality. One of its greatest features was the nature that existed here. And so an early design principle was preservation of nature, preservation of the views, and that really started driving some of the other design principles. The curvature of the hospital, for instance, so that it was overlooking the Wooded Ravine, was part of an early design principle so that the majority of the patient rooms would have the view to nature. So preservation of nature, views to nature, was going to be a key design principle for the hospital and really create the backdrop for a healing environment that's spiritual and certainly blended with nature. And that in and of itself, I think, creates an environment that's comforting, that exudes confidence within our patients and those that visit. The interior design theme is simple elegance, so you blend simple elegance with nature, and it really does create that healing environment yet spiritual environment. Knowing that it's a beautiful place where you can find solace and you can find respite while you're going through some difficult life challenges. The idea that the art pieces were chosen very deliberately, all which have meaning and purpose behind them in terms of how a patient or visitor might relate to them. So whether it's the St. Francis statue created by Brother Mel, whether it is the mosaic, the stained glass that's in the chapel, whether it's the Stella Maris and the healing gardens that exist around the facility, or the Healing Hands artistic work that was done in the emergency department, I think it speaks to someone's spirit and provides that comfort and provides that compassion that you look for when things aren't quite right in your life, or there's sadness or particular event that you may be going through. Stella Maris was first commissioned as a gift to the hospital back in 2004 by the family of Gary and Millie Schell, who are local residents here in Jefferson City. They commissioned Sabra Egan, who is also a local artist, but had risen to international acclaim for her artwork, sculptures, paintings, and other genres in which she worked. The vision for Stella came about from Sabra and was first presented to St. Mary's as well as the Franciscan Sisters of Mary to ensure that the vision of Mary was approved by the Franciscan Sisters. We started working through schematic design and realized that the location of the Stella Maris needed to be a more intimate space, a more reflective space, and that's one of the reasons why the Stella Maris garden was created on the south side of the hospital rather than on the primary entrance of the hospital. We wanted to create a place where people could come and reflect, meditate, pray, and be outside in private moments. It was designed to inspire as well as really encourage conversations of the heart of individuals.
Well, St. Mary's has been with Jefferson City since 1905, so we'd like to think we've been impacting the community for over a century. We're very blessed to have the opportunity to continue that mission, we think, for another century and beyond. Clearly, we've kept the lights on in the building every day for the last 100 years, and we're excited about that. We're a big part of the community, and the community is a big part of who St. Mary's is.
St. Mary's takes its citizenship in the community very seriously. We work very closely with MoDOT, the County Commission, and the Mayor in order to build the interchange and Mission Drive. Along with that, we included local firms and workers in the construction process, with over 70% of the workers coming from the local community.
There has been 750,000 hours of local manpower that's been going on since groundbreaking a couple years ago. It's been a tremendous impact for the local economy. Those are local contractor hours, so 750,000 hours is a lot.
This hospital sits here as a symbol of growth and economic development. The way I see it, I'm very proud that SSM Health decided to make this investment in Jefferson City. And what it does to us is gives us a tool to go out there and recruit businesses to come to Jefferson City. When they look at Jefferson City, decide if they're going to locate a business here, they want to see that we have quality of life. School system is part of that, and healthcare is a big part of that.
Primarily for the tremendous impact that's going to be in the future for the people in the community is going to be the local expansion and quality of healthcare in the Central Missouri healthcare industry.
This is a culmination of many years of collaborative planning among various organizations to address both the present and the future healthcare needs of the community. I was fortunate that I was born here, our children were born here, and I recently was hospitalized at St. Mary's for an illness, and would let everybody know that I received extraordinary care and attention. And this is just one thing that ensures, should something happen in the future, SSM will be here for those needs.
The quality of this project is just tremendous. If you look at the architectural design, the quality of the construction, and just the overall beauty of the project, it's something that doesn't compare to anything in Jefferson City. And I think that's really the most exciting part, is just the tremendous quality of this project.
This hospital is a symbol of peace of mind. We can live here, we can work here, and if something happens, we know that we've got the resources and the technology to be taken care of.
And it's just nice to know that if something comes up in the future, St. Mary's will be here. It will be here for my family, and we're just very, very proud to have a facility like this located here in Jefferson City.
Of course, I was born in St. Mary's. I got my first cast put on for rough housing at St. Mary's. And over my life, I've had a lot of memories in St. Mary's, either visiting family or friends, etc. It's a whole new generation here that will have those same experiences here. So that, for me, that's just, they put 100 years into our community, they're going to put another 100 years into our community. So I'm very excited about that.
Now that we get ready to move and operate, we're looking to expand and grow. We want to be the healthcare provider of choice for the people of Jefferson City and Mid-Missouri. And we think we've done that quite well on this campus with this new building, and quite frankly, with the people that are dedicated to our mission.
At St. Mary's and in the SSM system, our mission statement is, through our exceptional healthcare services, we reveal the healing presence of God.
So we're an integral part of the community, and the community is an integral part of who St. Mary's is.
In healthcare, obviously our first hope is to be able to cure. But when cure isn't possible, we know that healing is possible. And for people of faith, that means that they're open to God's presence in a variety of ways.
Sisters of St. Mary's, they are continuing their tradition here of offering a spiritual setting for healthcare needs that addresses the overall wellness of the individual and their family.
Every day we witness stories of healing in our hospitals and clinics. And very often that means a patient recognizing God's presence in even the smallest things. It may be the kindness of a nurse. It may be the way they're treated by a physician. It may be a housekeeper who comes in and has a meaningful conversation with them. We witness those stories every day. We tell those stories because they really inspire us to continue to do what we do. And that's very much a part of why most people feel called to minister in healthcare. The design of the chapel actually came about over several years. The design is intended to invite people in. It's another way that we bring some of nature inside, the soothing earth tones, for one thing, the natural elements that are a part of it, the stone on the wall and the natural stone in the sanctuary are all intended to have a comforting, soothing effect and just to be very inviting. There also are elements that bring our past forward. The Stations of the Cross, as you see in the background here, were in our original facility. They were taken down and refurbished so that they would match this environment. In the windows that you'll see, there are images at the top of each window and at the bottom of each window. And the stories at the top, each of those stories depict a scripture story in Jesus' life. At each of the corresponding lower images in the windows tell the story of our founding sisters, the Franciscan Sisters of Mary. And they correspond with a nurse who is a sister taking care of first an infant, then an adolescent, then a woman who is pregnant, and finally a person who is of old age. And then the centerpiece of the chapel is the stained glass window in the sanctuary, and that is an image of the Pietà, the image of Mary holding the body of Jesus after he's been taken down from the cross. And the reason that we wanted to make that the focal point in the chapel is that very often people are going through very difficult times with a family member who is here and who may be on the verge of death, or who may be facing very serious illness, and in some cases, patients who die. And very often, people of faith can draw inspiration from the life of Jesus, the death of Jesus, and the love of his mother throughout all of his journey. And so it really is intended to be a source of inspiration, but also a source of deep comfort for people who come here.
We've gone from a facility that's over 100 years old to a facility that's brand new. So you have all private rooms, you certainly have beautiful facilities as far as the colors and the aesthetics. And I just think the whole layout here, with it being on top of the hill and the setting, just looking out the patient windows, it's a very peaceful setting. And I think it's going to be a great place for healing.
I've been fortunate to train and work at some really great institutions: Wake Forest University, University of Southern California, Royal Liverpool Hospital, which was founded by Florence Nightingale. And this is the single most well-designed and constructed facility I've ever worked, I'll ever have the chance to work in. And it's just that all the human factors that go into creating the workplace environment and experience for patients and families are just outstanding.
This is a truly beautiful state-of-the-art facility, but more importantly, it's about the care that's provided by the employees and the physicians. Employees of SSM Health are committed to ensuring exceptional quality, safety, and service every day with every patient, with every encounter.
Bringing the nature in from outside, just the whole campus with the outdoor spaces, which are really nice places for patients if they need to be by themselves or maybe a more reflective time. I think it'll be a great experience for patients and families.
The facility was planned with direct input from the hospital employees and the physicians. It wasn't like some firm just gave us a blueprint and that's what we built. The employees and physicians were involved from the beginning stages with this facility, and it was designed with patient care in mind. So we really looked at our workflow and efficiency and what's going to be best for the patients, and those ideas were incorporated into the design of the hospital.
We all love the old St. Mary's facility. It's such a great part of the history and fabric of this community. But of course it was built in stages over a period of, over a century, I think. And that created some inefficiencies in the way, we kind of had to do things and the way our workflows went and our patterns of work throughout the day. And this facility really gets rid of all that, and it creates just a really efficient, great workspace for us.
SSM Health has a real commitment to this community, and I think that's very important. You don't invest $200 million into a building unless you're there to stay and you care about the community and are committed to it.
As the president and current steward of St. Mary's, I see myself standing on the shoulders of those who came before us, and it's a privilege and honor to be able to continue the 109-year legacy of St. Mary's well into the future.
That's just a small sample of the faith-based services St. Mary's Hospital will provide. They hope that you'll trust them for the next 100 years as they continue to grow with you and your family. Thanks for joining us. I'm Megan Lane.